Hi, this is Terry Kuti. Welcome to Deep Sea Foundation educational video channel where we discuss all topics related to breast cancer and breast reconstruction. I'm very honored today to have my guest, Sarafina Nance, who is a PhD student at UC Berkeley and she's studying astrophysics. So,
That's right. Thank you so much for having me.
yeah, well, thank you very much for being here today. I'm kind of guessing that maybe the viewers are wondering why I'm interviewing an astrophysicist.
Yes, probably.
Yeah. Well,
So,
if I may use a little tongue-in-cheek, Serafina, I think that our worlds kind of collided. The stars lined up, if you will,
absolutely.
when I found out that we both have been affected in different ways by breast cancer. So can you begin by sharing your story with us and telling us why you chose to have a prophylactic mastectomy at such a young age?
Sure, yeah. So, my dad was diagnosed with prostate cancer when I was 23, and he was diagnosed at stage 4. And so, pretty immediately after he was diagnosed, they suggested that both he and I get genetic testing. And we both came back positive for the BRCA2 mutation. So they suggested that I wait until I was 25 to start doing routine screenings. And in my first routine screening, they found something that ended up being benign, but just through the whole process, I kind of, with the anxiety and all the fears, and also just wanting to be, I guess, sort of like proactive about what was going on, I decided to just move forward and get my mastectomy now. So I just had it in November, and it really was this confluence of, I found an amazing surgeon. I'm young, I'm healthy right now, and so I felt like it was a really good time for me to go ahead and move forward and do it.
That's an amazing story. So Serafina, you were very impressed with your breast surgeon, who I know, by the way, she is a wonderful, wonderful person. What I'd like for you to share with the audience and the viewers, it's a process. It's a process to find the right breast surgeon. You're a very educated young woman, and so when a woman goes in for her consult with her breast surgeon, her plastic surgeon, there are a number of scenarios, all the way from I've come in with tons of information, which I know that you have, with your background in education and being a wonderful self-advocate, by the way. And there are those who don't know where to find, the resources in education. Walk us through that process in a manner when you are speaking about it. Talk to us as if you're talking to other young women, and what advice would you give them?
Yeah, I think the number one thing I can say is that knowledge is power, and by equipping yourself with knowledge, you set yourself up for having the best possible sort of situation. So I was actually a little bit frustrated with the process when I was going through it, and I'm a trained researcher, and I still had issues, finding information about who to go to for surgery and what types of surgeries there are and what are the risks associated with the surgeries. And so it took me actually a very long time to do it. And I remember thinking, if it's this hard for someone like me who's trained in research, I cannot imagine how daunting this process is for other people who, don't have that background. So I think there are a number of resources out there that helped me a lot. I literally went on PubMed, which is, this resource of papers that academics in the medical field will publish to. And I just started researching for sensation, for any sort of aspect of the process that I was curious about. And I tried to, for my part, I tried to combine a lot of the research that I did, and I put together a guide to breast surgery to hopefully help some other people who are going through the process as well. It's definitely non-exhaustive, but I think having a centralized form of information is really helpful. And it can be really scary, but equipping yourself with that information, it can be a game changer in terms of, moving forward with the process.
It is. I like to talk about a shared decision-making process, and that is what gives a patient ownership and, really feels like they're a team member in the process, which it sounds like you were. So is that resource that you have put together, is it available?
Yeah, absolutely. It's on my website. So it's starafina.com. But yeah, no, it's publicly available. And if, anyone has any edits or things that they want me to add, I'm happy to do that. It started as a Google Doc, and I was like, I need to make this more publicly available for people. So yeah, no, I think, everybody should have some resource like that.
Well, we will be sure and have that information available at the end credits. Another thing that I would like to ask you very quickly. So we both have had breast reconstruction. We've had different types because there are options for breast reconstruction. You chose implant-based reconstruction, Sarafina. And so tell us a little bit about why you chose implant-based, and then explain to the viewers also the considerations that have to be, taken into place, because when you choose implants, this is not an aesthetic plastic surgery procedure. You're actually
Right.
removing the breast tissue. So talk to us about profile, sizing, and what kind of conversation should young women be having, or anyone for that matter, who's choosing implant reconstruction?
So I was actually very curious about doing autologous tissue reconstruction because, I thought, well, if I don't have to have foreign bodies in my body, that would be great. And when I met with surgeons and I met with Dr. Peled, we kind of came to the conclusion that for my body type, it just wouldn't work well. So I didn't really have enough fat in various regions in order to make it work well. And so that was one consideration. And the other one was really time to get back into my life. And, I really didn't want that long of a recovery. I was really nervous about that. I was really nervous about having a surgery that can last for 10 plus hours. And so I was really excited about having the option to do implant-based reconstruction that is, a shorter surgery. I think mine was 5.5 hours for both the mastectomy and the reconstruction because I had direct to implant. And I was back in the gym like 3 weeks after surgery. I was light working out, but I was moving my body, and that was really exciting and great for me. So I think the time, the recovery time was a big aspect of it, as well as I did over the muscle, which was important to me because I gained immediately after surgery. I didn't lose any sort of muscle or anything like that. So it really was for me this sort of non-invasive, amazing result that I was like, great, that sounds amazing. And Dr. Pellet does resensation with implants. So, I didn't have to give up that aspect of that.
Yeah, tell us about that a little bit, because this is a little bit of a new horizon that she is working on, and I was able to interview her last week about that. So please tell the viewers about that. It's really very exciting.
Yeah, it's incredible. So she's one of the only surgeons in the world she and her husband work together to do nerve preservation and nerve grafting in implant-based reconstruction, which basically means that you can regain sensation with implants. And so that is an entirely new procedure. Historically women and people getting mastectomies have not been able to retain sensation unless you have sort of this autologous tissue or not implant-based, but autologous tissue reconstruction. So I had nerve preservation on one side and nerve grafting on the other side, just based on my anatomy. And I am a little over 6 months out of surgery, and I have full sensation on my right side. And sensation in about 3/4 of my breast on my left side. So it's been amazing. You know, I am so grateful for advances in technology and surgeons who really advocate for people to have this. I think it's really important.
Well, and just speaking to you about it today is going to help others ask the question. Just to be honest with the viewers, not all surgeons are currently doing this.
Right.
But the exciting thing is it is being developed, it is being looked at, and Dr. Pallett and her husband, the other Dr. Pallett, I call him,
Exactly.
they have done really great things with this nerve preservation and nerve reconstruction using the nerve graft. And so, what last words of advice, Sarafina, would you have for young women who have tested BRCA positive or any gene mutation that puts them at high risk? What is your best piece of advice today for them?
I think the thing that I always try to say is that knowledge is power, and equipping yourself with as much knowledge as you can get, building a community with people who also have the same experiences was really helpful for me in order to get that knowledge and also to get support. And so I think, you know, being able to advocate for yourself with that knowledge is incredibly powerful. So I encourage everybody to do that.
Well, I really value your voice, and I think that strong voices in patient advocacy only help other women to realize that they too can be their own best advocates. So we're going to have all of your information available at the end of the video. Thank you so much for joining us today.
Thank you. Thank you so much.
You look great. You're what, about 6 months out of your reconstruction, right?
Yeah, that's right. Yeah. I feel 100% back to normal. Very lucky.
Yes. All the stars aligned.
Yeah. Thank you so much.
Thanks, Sarafina.
All right. Thank you so much.
Bye.
Bye.